people do not have any knowledge about the non-communicable disease, while 40% of the people have knowledge about the non-communicable disease. Respondents suffering from non-communicable disease. This figure showing that 67% do not suffering from the non-communicable disease, while 33% of the people are suffering from non-communicable disease. Most common non-communicable disease in this area, we see that most of the people are suffering from hypertension in our survey, while 20% of the people are suffering from asthma, diabetes, and both diabetes and hypertension, and only 20% of the participants are suffering from ischemic heart disease. Percentage of the affected people taking different type of treatment. In our survey, we see that 60% of the people are taking the oral medication for their for the non-communicable disease like diabetes, hypertension, asthma, etc. And 20% of the people do not have take any medicine. They control their disease by changing their lifestyle. And 20% of the people do not take any medication for their disease. Family history of non-communicable disease of the recipient. It is very important for the non-communicable disease patient, because sometimes family history implies various side effects to the participant, because in some cases like diabetes, hypertension, family history is very important risk factor. We see that 25% participant have their family history, but most of the participants do not have any family history. Risk factor of the non-communicable disease. This slide show that 40% of the participants do not have any risk factors of non-communicable disease. Ideas about availability of treatment of the non-communicable disease in the nearest hospital. We see that 60% of the patients have idea about the place from where they will take the treatment, and 40% patients do not have any idea from where they take the medication. Knowledge about the prevention of non-communicable disease. It is very important how to prevent the communicable disease to save them, but we see that only 9 participants, which comprises 30% of the participants, have idea, but majority of the participants do not have any idea, which is about 70%, about prevention, how to prevent the non-communicable disease. Respondent advice about the healthcare facilities more available for better service. Only 5 participants give some advice how to improve the awareness and to prevent the non-communicable disease, but majority of the participants do not give any advice how to prevent or facilitate the health service in their availability. Most of the participants given their opinion, as they do not have any community clinic in their union, so they do not get appropriate treatment, advice or awareness among the non-communicable disease. Conclusion. The primary objectives of our study was to assess the presence of non-communicable disease and awareness of non-communicable disease in rural people in Degargaon, Kumilla. While the majority of the participants have some level of education, a sustained number lack awareness of the non-communicable disease and their risk factor. In summary, this survey underscores the urgency of addressing non-communicable disease in the area through extensive healthcare programs and consider the special demographic, educational level and risk factor of the population. It is essential to raise awareness, promote healthy lifestyle and ensure accessible healthcare to mitigate the burden of non-communicable disease in their community. Here is some recommendation to prevent raise awareness among the villagers to prevent the non-communicable disease. Health education promotes targeting middle class, middle-aged and older individuals can be implemented. Gender-specific healthcare intervention can be developed. Health literacy among individuals with the lower educational attainment should be promoted. Preventive measures accessible to the housewives and farmers should be promoted. The government should consider affordability in the healthcare initiatives. Thank you for your patient hearing. Now this is the time to ask some questions.
So, thanks to both the presenter for their brilliant presentation. Ladies and gentlemen, now floor is open for question and answer session. Please raise your hands and ask question to the presenters.